Karen McKay-Eden from the Ontario Nurses Association and Michelle Robidoux from the Toronto Health Coalition. And I'll be doing a longer introductions of them in a few minutes, but I want to start with land acknowledgement. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credits. And I think, in the context of the land acknowledgement, the First Nations people have been stewards of this land. The first footprints that have been found date back 11,000 years in this area. And so they've been stewards of this land for 11,000 years. And I think when we're having this kind of meeting, we should be thinking about stewards of not only this land, but of a healthy society going into the future. And as the First Nations people traditionally talk about it, for at least the next 7 generations. So when we're talking about designing a healthcare system, it can't just be for today or tomorrow. It's got to be about designing a healthcare system that will be serving the people of this land for the next 7 generations. Let's see. Before we get into the speakers, so each of the speakers is going to do a bit of an introduction, but I wanted to provide a little bit of context to the privatization of healthcare before we get into this topic. I actually got involved. I got involved in politics in the early 2000s when Mike Harris was the premier, and he was making all kinds of cuts to schools when my kids were in elementary school. So I joined a parents group. We were fighting those education cuts. And what I came to understand through the research and the advocacy I was doing at that time was that the goal was really to privatize our education system. The government's own report showed that they had underfunded our publicly funded schools, public and Catholic schools, by $1.2 billion. And at the same time, they had introduced a private school tax credit that, if fully realized, would have cost $700 million. So they were directly taking money from the public sector and giving it to the private sector in our education system. And this is just one example of many privatization schemes that have been implemented at the provincial level and also at the federal level over the last 25 years. The sale of Ontario Hydro is probably the most top of mind privatization scandal that we've come across in this province. When in 1995, when the Conservatives got into power, they began to break up Ontario Hydro and sell off the pieces. They sold, for example, the Bruce nuclear plant to a British company. They were selling off all the pieces. And the final piece of that was in 2017, when the Liberal government sold the final tranche of the majority shares of Hydro One. So now Hydro, what used to be Ontario Hydro, is a private for-profit company. And that final section was sold for $9 billion. So the government sold, between 2015 and 2017, 53% share of Hydro One for $9 billion. And before this privatization started, in 1995, our hydro rates in Ontario were 4 cents a kilowatt hour, and they had been consistently 4 cents a kilowatt hour for 70 years. And it was largely because our hydro was a publicly owned not-for-profit agency. And so they were to provide electricity at cost. And when it got privatized, we're now paying 4 times that. And that when you compare the $9 billion of the sale, we are now subsidizing this private for-profit corporation to the tune of $6.9 billion a year in order to maintain our rates at between 8 and 16 cents a kilowatt hour. So the rates that we are paying are artificially kept low by tax donations to this, what is now a private for-profit company. When I look at, especially across this province, one of when we look at the rising costs, and we look at the rising costs of, for example, hydro, It's a real burden on many people. We look at the rising cost of housing. We used to have a strong public sector presence in housing. We've got 18 co-ops in Spadina, Fort York. No co-ops have been built, no scale co-ops have been built in the last 25 years in this province. So it's all a private for-profit market for housing in this province. And what's happened with that privatization is that housing has become unaffordable and there are no affordable options for people. So when we're looking at, the privatization of healthcare, it's about a longer term goal of this government and of the last government to privatize public services and to sell off public assets. And ultimately what ends up happening is it raises the cost of living for most of us. And this is the real challenge. So when we're looking at the privatization of healthcare, it's something that I feel very passionately about, because public healthcare has worked since 1965 when we first brought it in. It's not only more efficient, it's far more cost effective. Compared to the private for-profit system in the United States, we pay about $8,000 a year per person per year in Canada for healthcare. It's the United States, they pay almost double that. And most of it goes to HMOs and to profits. And so, it's when companies, it's also one of our biggest competitive advantages. When companies are looking to locate, whether they're going to locate in Ontario or Canada or locate in the United States, one of the competitive advantages they look at in Canada is our costs, the health costs for their employees and for them as a company for our public healthcare service. And so our public healthcare service is a competitive advantage for us. And it's one that we are going to lose if we allow this government to privatize it. And the other thing is that in the United States, the healthcare is completely dependent upon your ability to pay. Whether you get healthcare or not, there are 30 million Americans without health insurance. Everybody in Canada has health insurance. So just from a humanitarian perspective and from an economic perspective, it's absolutely vital that we protect our public healthcare system. And at the same time, we've got to recognize that the privatization of healthcare is part of a larger scheme and agenda of this government and of the previous government to privatize public services and to sell off public assets. And ultimately, those things, the privatization means that we end up paying more and we are not as well off as a society. So I just wanted to provide a bit of context, and now I'm going to go to our guest speakers. If you have comments or questions, the chat box is open. By all means, put in those comments and questions. We've also received a number of questions in advance. So after the introductory remarks from our guest speakers, we will be going to those questions, and we'll be also taking in some questions from the chat. So you'll be, if you have questions or comments, we'll be able to hopefully get to respond to as many of those as we possibly can during the time that we've allotted. So we're going to start with Dr. Claudette Holloway. She's the president of the Registered Nurses Association of Ontario. Claudette has more than 35 years of nursing experience, including 10 years of leadership as a program manager at Toronto Public Health District Administration for St. Elizabeth Visiting Nurses in Toronto, and nurse manager at the John Noble Homes for the Aged in Brantford. She has taught in undergraduate programs at TMU School of Nursing, York University, and Centennial College Collaborative Program, and is an inaugural executive director for Jamaican Canadian Association of Nurses, a charitable philanthropic organization that supports seniors programs and housing. Claudette and Dr. Holloway, it's wonderful to have you here. Thank you so much for taking this time to be with us, and we'll pass it over to you for your opening remarks.
Thank you, MPP Glover, for the opportunity to be here, and good evening to everyone. And on behalf of RNAO, we are going to do our utmost to protect our publicly funded system so that we have not-for-profit healthcare RNAO is not against not-for-profit centers that provide healthcare. We know that over several areas of Ontario, there has been private clinics that are not for profit. There's also been clinics that are for profit, but we're not against those that are in a not-for-profit situation. So we have seen the government make these announcements lately that are not supportive of nurses or our publicly funded system. We know that coming into the pandemic, we were already short because Ontario is already behind other provinces, not only for pay and compensation for nurses, but also for filling vacancies, because nurses are not interested in staying in Ontario right now because of Bill 124 and the fact that our Premier is appealing that, which was struck down by the government, by the judicial system, but continues to pursue it. So we are already in a situation where we have a crisis, and putting additional private clinics is not going to solve the situation. We need to look at a long-term care strategy of retention and recruitment, where we can sit down and talk about how we can continue to build what the Healthcare Act has provided is a publicly funded healthcare system. So we know that lots of action alerts have been signed by people in this province led by RNAO that are against privatization. We know that people have said that they have accessed these clinics and have done well with them, but we're advocating for a system that is equitable, something that everyone can take advantage of. We don't want people to jump ahead of the queue. Everyone needs to have and deserve excellence and access to healthcare. So in profit, there's no guarantee that things are going to go any better. But we know with our healthcare system, we do have our publicly funded system, we do have strategies in place that will protect the excellence that is given by nurses, and our public funded system is only going to suffer when these private clinics suck resources from what is already there in the publicly funded system, because the privatization, they're going to have to get their staff from somewhere. So where are they going to draw them? They're going to draw them from our publicly funded system. We've already seen that with agencies and taking nurses to supply hospitals because they could not get nurses to work. And there's our healthcare dollars being overspent in ways that could be spent better in a publicly funded system. So hopefully, MPP Glover, that's a start.
That's a wonderful start, actually. I just want to clarify. So you're saying in the public, and you're saying that in the public system that we've got right now, the nurses are underpaid. And so they're not wanting, they're leaving the province, or they're going to these private for-profit agencies. And so you're suggesting that the healthcare, the real problem with our healthcare system is a shortage of healthcare staff. And if we start funding these private for-profit clinics, it's not going to magically increase the number of healthcare staff. It's just going to draw them out of the public system into the private system. Is that an accurate summary of your points?
Well, to be clear, the Bill 124 is what is driving our nurses away. So yes, we are terribly short, but we have done nothing. And it is a first step. The government has done nothing to stop the bleed. So as many nurses that we are trying to bring onto the system, you know, bring in our internationally educated nurses on board to help. There are processes that are in place, but once you get your staff in, they're just going to leave because they want to go to other provinces across the border into private care where they can make a fair wage and get adequate compensation to support themselves and their families. So yes, we've already come into the system short. And having this announcement does not do anything to help. It's going to make the system worse.
Okay, thank you very much. And I'll just note too that the government's actually appealing. Bill 124 was found to be in breach of the charter rights of the healthcare workers, of the workers of Ontario. and the government's appealing that decision. So it looks like it's going to stay in place for the time being. Okay, thank you so much for your comments, Dr. Holloway. Our next speaker is Karen McKay-Eden. She's the Vice President of Region 3 Ontario Nurses Association. Karen represents more than 28,000 registered nurses and healthcare professionals in the GTA. A long-standing nurse with decades of frontline experience, Karen most recently served as the local coordinator bargaining unit president at Mount Sinai Hospital, Local 82. In her role as Vice President, she aims to continue to encourage members to engage, to mobilize, and to address and resolve professional practice issues. Karen, thank you so much for being here for our town hall. You've got the floor.
Thank you. Thank you very much for having me. It's so important that we come together to organize and fight back against Doug Ford's dangerous plan to privatize hospital care in Ontario. Let's be very clear. Ford has created the crisis in our public healthcare system. His own government's internal documents state that the wage suppression through Bill 124 has led to retention issues within the hospitals. Allowing private companies to profit off people's surgical care is not going to solve the staffing crisis in our hospitals. In fact, this scheme is only going to make the staffing crisis worse. There are a number of reasons we are opposed to privatizing hospital care in Ontario: staffing, price gouging, cost to patients and taxpayers, and the quality of care. Doug Ford has said he's going to ensure nurses and healthcare professionals to staff up new private facilities won't be poached from our public system, but he has no plan to prevent this. These facilities will be able to offer better working conditions and competitive wages because they're not limited by wage suppression laws like Bill 124. That's going to draw nurses out of the public system. Instead, Ford should be investing in increasing staffing levels and improving working conditions in public hospitals. This government needs to respect workers and drop its appeal of the court decision overturning Bill 124. On cost, we know that patients are already being pushed to buy upgrades at private clinics, and this is costing them hundreds or even thousands of dollars on their credit cards to get the care that they need. Access to healthcare should be based on your needs and not on your bank account or your health status. The business model for these private clinics is to do the lowest risk, highest profit procedures. At Shouldice, for instance, the private hernia clinic Ford loves to hold up as an example. People are turned away if they're deemed too high risk, and some are even told to go away, lose 50 pounds, and come back again. In a publicly funded healthcare system, no one should be turned away because of their pre-existing health conditions. Since his announcement, Ford has been asked repeatedly if these private clinics will be charging the province more per surgery than it costs to deliver these surgeries publicly. Ford has refused to answer every time. The only incentive for private company is profit. That profit is going to come from the taxpayers' dollars we all pay into, funding that should only be going towards care. For 5 years, Doug Ford has refused to listen to frontline healthcare workers as we have offered solutions to improve our public healthcare system. Now we know it's because he's determined to privatize the system and let private companies profit from our healthcare. We can't let this happen. Ontario's public healthcare system is not Doug Ford's to dismantle and to sell off to his corporate buddies. Our public healthcare system has been built up over generations, and it belongs to all of us. The Ontario Nurses Association is working hand in hand with our allies to fight for the investments we need in our public healthcare system and to stop this dangerous plan to privatize hospital care. Thank you.
Okay, Karen, thank you so much. I just want to pick up on one point that you mentioned, turning people away. You were talking about how private for-profit companies want to maximize profit. And so they're only going to, and I don't know if you used the term cherry picking, but that's the term that came to mind, which are the procedures that they can make the most money off of, with the quickest return. Is that what you've seen, or is that what we're hearing about from these private for-profit clinics?
That's what we feel is happening. Yes, they're going to take the low risk. And as he said in the media, it's the no-brainer surgeries apparently that he's going to do at these clinics. And anybody in healthcare knows there's no such thing as a no-brainer surgery.
Yes, I think anytime someone's taking a scalpel to me, I don't want them to have their brain turned off. Thank you. Okay.
Exactly.
Okay, our next speaker is Michelle Robidoux, and I see the chat is already very active. I'm following along with what's going on there, and we're going to get to some of those comments and questions in just a minute. But our next speaker is Michelle Robidoux from the Toronto Health Coalition. Michelle is a founding member and long-term healthcare and social justice activist. She has organized and attended numerous rallies and protests to help people fight to protect public health care and stop privatization. Michelle, it's wonderful to have you here. You've got the floor.
Thanks very much, Chris, and thanks so much to you and your staff for organizing this event. It's extremely important that it's happening, and I'm really pleased to be a participant. The situation, obviously, well, certainly from my point of view, and I think from my other panelists, couldn't be more urgent, and our time is precious tonight. So I'm going to focus on a few points that I think are critical to understanding the consequences of Ford's attack on public Medicare and to building a fight back against it. And I'm hopefully going to build on what the other panelists have talked about and what Chris outlined about the general picture with privatization. Ford's plan, if it's allowed to go forward, I think poses an existential threat to public Medicare. I'm not the only one who thinks that. Advocates across the province have been raising the alarm over the past 10 days or so, and obviously before that. His plan to hand over cataract, hip, knee, and other non-serious surgeries to private for-profit clinics, with eventually half of all surgeries being performed outside of the public healthcare system, is going to siphon resources and staff away from public hospitals at a time when a massive reinvestment is urgently needed. That is what we need right now. Hospital staffing shortages are going to get worse, and wait times for urgent care are still going to grow in spite of this announcement. But investors are going to line their pockets with public money. Let's just call it what it is. The push for privatization is driven by very powerful private sector interests that are lobbying to access what they see as a $600 million market for these surgeries. And this is not new. It's been going on, in fact, since the birth of Medicare. And I think it's important to say right off the top that the reason people are upset and concerned and worried is that before Medicare, it was down to how much money you had, how you could afford to get the medical help that you needed. And nobody wants to go back to that. That's why there's such a strong support for Medicare in this country. And I know there's a discussion in the chat that I'm eager to get into about all the different models that one could look at for, what kind of system do we need? But the bottom line is, when Medicare came in, it became very popular, and it has maintained that because people recognize that you're going to have a very different life if you can afford healthcare or if you can't. So we saw the same thing with long-term care. It was privatized under Mike Harris to disastrous effect. We could talk about the deaths of over 5,000 people during the COVID crisis, the majority in for-profit long-term care. So the Ford government is moving at lightning speed on this. They've announced that bids are already out for 3 private hospitals. They've announced 14,000 cataract surgeries are going to move to the private clinics, and they've given tens of millions of dollars in new funding to private clinics. And just to give an idea of the difference in using public funding for publicly delivered versus privately delivered care, it's being reported that private clinics are billing OHIP at different rates than hospitals. So, for example, cataract surgery in a hospital is billed at $450. In a private clinic, it's $600. That's what the OHIP payment is. On top of that, they're able to make money in the private clinic with physician fees, facility fees. The hospitals are taking complex patients. So if they get a complex care patient that costs the hospital $700, it's offset by a standard patient that may only cost $300. In a private clinic, they don't take complex care patients. Their profit is higher. So we have to look at the finances of this. and see that this is a loss for the public system. Those are dollars that could be within a public system and cover greater ground. So it's a choice that Ford is making. It's one that is going to, frankly, decimate public hospitals. It's a choice the Conservative government is making to rebuild the system inside the private sector instead of building capacity inside public hospitals or clinics that are under the aegis of public hospitals by addressing staff shortages and funding. And it's not an efficient use of public funds. Currently in hospitals across the province, there are operating rooms that are underutilized. And in some hospitals, operating rooms are even closed because of lack of funding or lack of staff or both. And it's a waste of a resource. So no matter what Ford said, this isn't innovation. Innovation would be finding a way to use the resources that are currently sitting idle. What this is just privatization. So where will the staff come from? I think the other panelists have addressed this. It isn't hard to see after 3 years of COVID and what healthcare workers have been through. Ford continues to try to depress healthcare workers' wages through Bill 124, which he's appealing the fact that it was ruled unconstitutional. He's spending tax dollars to fight the nurses, fight the healthcare workers and public sector workers by capping their wages. Yet the government's sitting on over $2 billion in a budget surplus. So we know the staff is going to come from the existing public system, no matter what kind of magical thinking Ford and Sylvia Jones want us to adopt. And it's this choice they're making is either properly fund a public system that provides care based on need, or fund private institutions which operate based on extracting profit. There's been a suggestion that this plan could work if there was close oversight somehow to stop private clinics from upselling, which is what they are currently doing. As it is now, private clinic inspection reports are contracted out to a third party. So they're not liable to the Freedom of Information laws, which is really convenient for Ford. So we don't know what's happening, but we're hearing through the Ontario Health Coalition, cataract patients being upsold, things like eye measurements, lenses to the tune of hundreds and even thousands of dollars. That doesn't mean every single person is experiencing this, by the way. I know there are people who are not encountering this, but this is where the profits have to come from. And similarly, it's illegal for these clinics, these private clinics, to give you a different timeline on your surgery tied to paying for upgraded lenses, but it's happening. And Ford has done nothing to stem this. This is not a done deal, and I will finish on this. We can't stop this, but it's going to take all of us. Public opinion is very strong in support of public health care. Public opinion is vastly stronger in support of healthcare than the 18% of the voting population Ford received in the last election, and that he's basing these policies on. He does not have a mandate for what is happening now with this plan for private clinics. And it means there's a lot of room to grow the campaign to stop this. We know that he bold-faced lied before the June 2022 election, saying he would not privatize hospital services. He lied about the Greenbelt, and he vowed not to open the Greenbelt up to development. There is room for us to challenge this. I will stop. I'll wrap it up.
Okay, yeah, I want to open it up because we've got a really good discussion going in the chat here, and I want to pick up some of those questions. And we've got some questions from beforehand, but you covered at least three really important topics. You talked about, and it answered some of the questions that are in the chat. How will these private for-profit clinics make a profit? And you answered that. You said they're going to charge, they're actually charging OHIP higher rates than public hospitals are allowed to charge. And they're cherry picking patients. They're doing procedures and low risk patients. That's what they're choosing so that they can maximize their profit. You also mentioned that there's empty beds in operating rooms in the province. And I've seen that in the Auditor General's report, and I've heard about it from nurses. Karen or Dr. Holloway, have you seen this? Like, what I've been told is that in some hospitals, there are actually floors of empty beds. There's hallway medicine downstairs, but there's actually empty beds upstairs, but they're empty because they're unfunded. Have you seen that in our system?
Claudette speaking. I don't have any information about that, but as we can see from the last few months that emergencies have closed down, intensive cares have been closed down. People have had to be shifted to other hospitals. So if that's a sign, maybe there's other things going on that we're not fully aware of. I don't have any information about that. But the bottom line is that nurses are the backbone of the healthcare system. We fully acknowledge other healthcare workers. But if you don't have enough nurses, these things will continue. And if you don't fairly compensate nurses, these things will continue. When you put private clinics in place, they're going to need to staff them. And where they're going to go? To the nurses that we already have, and we're already short.
Mm-hmm. Okay, thank you. Thank you for that. I'll go to the next question that I've got that we received before the meeting. Can the government make it illegal for private clinics to add on extra costs for the clients to pay out of pocket? Is there anybody, so this is extra billing. Can the government make it illegal to extra bill at these private clinics? Can anybody respond to that? Michelle, you were talking a little bit about it. Or go ahead, Claudette.
Yeah. No, I was going to say, as far as I know, it's not legal, and Michelle will probably know more about it, and Karen. As far as I know, it's not legal, but the government is in the position where they can change legislation to suit whatever they intend to do. So that's what I would say right now.
Michelle?
Yeah, it's illegal. It's currently illegal. But as Claudette said, I mean, they are not enforcing it. They're not, and there's lots of blame to go around on this. I think, the enforcement of the Canada Health Act is just not happening. But no matter, you could put a lot of regulations. There are existing regulations that are not being enforced. And that's why I think people should be very concerned that once this is set, it's going to be very, very difficult to roll it back. And we will have serious inequity. There's already inequity in our health system. We know that, but this is going to absolutely accelerate it in a tremendous way.
Okay, that's good. And let's see. So the next question I've got here is, who is the staff that will be carrying out the surgeries that have been moved to the private clinics? We sort of covered that a little bit, but does anybody want to comment on that?
Well, Claudette speaking again. I'm sure Karen and Michelle will comment too, but these private clinics, they have no staff right now. So where are they going to get them? You don't create nurses overnight, so are they going to draw from the publicly funded system?
I agree. Yeah, that's the only place they can come from, or the private agencies, which have already poached from our public system, right?
Okay. I just want to read a comment in the chat, and I'll open it up for response. I think you are not understanding what this privatization is about. The government is planning on using private clinics to allow more access for public health care. We are not going to pay more. The government will just outsource private facilities to finally allow a more timely service to taxpayers. The government will pay these facilities so that more services will be available. Does anybody want to respond to that? Anybody want to start? Karen, I see you humming and hawing. Do you want to start on that one?
Well, as my colleague said the other day to me, I mean, he's built all these facilities, but basically all he's done is buy furniture, right? He doesn't have the staff in place to do it. He doesn't have a plan to get the staff in place to do it. He's, I mean, we're courting nurses from Manitoba. We're courting nurses from Quebec. He hasn't started, to my knowledge, offering signing bonuses as yet, but I know some hospitals are offering signing bonuses in other provinces. So, we're already the lowest paid in the province. And you know what? It's not just about the money. It's about the working conditions, right? We have the worst nurse to patient ratio in the province also, right? We just don't have the human resources to maintain this, as well as our publicly funded system.
I would just like to add, sorry, go ahead, Michelle, and then I'll come back.
Well, I think that what's astounding about what has been announced is that over the past few months, everyone has seen it. The ambulance lineups, the emergency rooms closed down, the code reds, the you know, the crushing pressure on healthcare workers across the province. And the announcement is we're going to lighten the load by taking these surgeries out of the hospitals. And it's missing the whole question of the underfunding, the chronic underfunding, the sitting on billions of dollars. And that's what is quite mind-boggling. The problems are this, the answer is completely unrelated. And it's not to say there isn't a problem with a backlog of surgeries. We know there is, but this is it's about undermining the public system in a profound way, because we know what happened to long-term care and to home care, privatized. And look at what's happening there. If you want to look at a model of what not to do, look at home care, privatization. And now they want to do it with hospitals. So be very afraid.
Yeah, it's a creep. It's a creep. It's been creeping all along. It's not, privatization is not new, but here it's expanding at an alarming rate. So we have to be careful about that, the water is not warming up. The water is boiling. We have a real crisis on our hands.
Right. You know, I just wanted to throw in one of the statistics. Karen, you mentioned that we have the fewest hospital or nurses per capita in Ontario. We also have the fewest hospital beds per capita of any province in the country. And that speaks to chronic underfunding of our healthcare system. We've had, you know, long before the pandemic started, we had Holloway medicine. And and at that time, what I was hearing about was those empty hospital beds that were empty because they were unfunded. So you had people downstairs in hallways and gurneys and empty beds upstairs, but they couldn't use those beds because they were unfunded. It was and it still is an absolutely insane situation. And you're talking about this, you know, the deliberate undermining of our healthcare system. And we saw this when I got involved in this in the Harris era. The Minister of Education said he wanted to create a crisis in our education system, and ultimately the goal was to privatize it. Is this government deliberately creating a crisis in our healthcare system in order to privatize it? And if so, are the patients who are suffering just sort of collateral damage in this ideological push to privatize our system? Michelle?
Yes. Yes. I think, I mean, we had a rally in December in Toronto outside of the major hospitals. This was before the announcement. This was before, you know, we knew the details of this plan. And at that time, Natalie Mera, the executive director of the Ontario Health Coalition, said this system, if you want a definition of a broken system, this is it. This is a broken system. And people were begging for these solutions if, you know, remove Bill 124. You are chasing healthcare workers out. You are chasing them out. And then you say there won't be a problem. There'll be some magical nurses. So I think it is being broken on purpose. You know, the Bill 124 is only one piece of it, but it's phenomenal. How do we run hospitals? People work in hospitals. People do this work, and and he's appealing it. He's appealing the Bill 124 thing again. That's what's galling in this. They do not care about patients, and they do not care about the backlog. It's about privatization. There's huge millions of dollars to be made here, and they're doing it in many other sectors, as was mentioned.
Okay, I want to read a comment from Lynn in the chat. She says, why pay tax dollars to private clinics rather than creating more public ones that we democratically oversee? This is how much of the education system works in the US, to disastrous results. Public schools in the US are in total decay, and tax dollars are paid to charter, i.e. profit-driven schools. So, you know, Lynn, you're making the same comparison. I mean, I come from an education background. I was a teacher and a professor before I became an MPP, and I agree with what you're saying. Like we're seeing the same thing happening with healthcare. Like they privatized the education system in the States to disastrous results. Another question from Daria is, can we have more foreign trained doctors and nurses included in our public healthcare system? I'll open that to you know, Karen or Claudette. Would you like to? Can we more rapidly incorporate more foreign trained doctors and nurses?
Absolutely. We need to break down the barriers for internationally educated nurses. We have to make the process more user-friendly, and we have to get them the training they need and get them up and working. Absolutely.
What are some of the barriers? Like, if you could remove the barriers, what specifically?
One of the big barriers is the College Nurses of Ontario.
Okay. And that's the
And the
credential.
registration. They have to be licensed, right? They have to be licensed to work in the province. And apparently they are working on something, although we haven't seen any results of that as yet. Maybe Claudette knows a little bit more about how the college is working, but that's what we need to do. We need to improve the process to get these people in the system. I mean, a lot of them are already working in the system as PSWs, right? They are doing healthcare. There's just barriers to becoming registered.
Okay.
Well, we want to thank the government for the processes they put in place to help the college move the registration process along. And we understand that over 6,000 nurses are now in that registration process, and now they've opened up a temporary class where nurses can actually, work under the supervision of a registered nurse. But you're right, Karen, we've had these internationally educated nurses here all along. We had thousands of them here, and now we're seeing that they can come alongside. Why have them on the sidelines when they can come alongside and help the situation? But we come back to the problem that sometimes hospitals do not have the resources to provide that support and orientation that they require. So again, we come back to fair compensation and workloads, which are extremely hampered by Bill 124. The internationally educated nurses are here. We're not trying to give them a free pass. We're trying to get them into the system, but we maintain the quality. And we do not want to take nurses from other places. I'm sure the same for physicians. This shortage is a global problem, but we're not here to support taking nurses from other places. We have some here, and let's work with those that have chosen to be in Ontario. And let's try and get them educated to stay in Ontario so that when they've actually got their registration and everything, they're not going to go off to another province or across the border.
Okay. Thank you. I want to, so a comment in the chat, I'd look for a response. Have you looked at how other countries are doing regarding this? Look at Europe and stop just looking at the US. That is not the system to look up to. Does anybody have any comments on European systems of healthcare? Michelle, I see you. Are you unmuting? Yes.
I'm unmuting. I was just going to put something in the chat about how to get involved in campaigning around these things. I will do that shortly. I mean, I think, I think there are a lot of very innovative ideas in different systems that you can see around the world. But in a way, I mean, I think there's a lot of very good ideas coming from people here who have tried different things that have worked much better. Like I said, why not build capacity in a system that is underutilized, like the one we have currently? Very simple thing, but I don't know that that's the real key thing that we need to worry about. What we need to worry about is, somebody put in the chat, calling the system broken is like calling a car broken because there's no gas or the battery hasn't been charged. And I think that's it. Like the system is being actually strangled or starved. So that doesn't directly answer your question.
No, but that's a good metaphor, actually, the car. We just need to fuel it up and then we can get it going, get rid of Bill 124, pay our healthcare workers a reasonable wage, and, start attracting more and training more. Let's see. If we need 200,000 nurses in Ontario, 6,000 is a drop in the bucket. My understanding is that now only 60% of nurses pass exams on the first try, as there is not enough supervised training opportunities. Any comments on that, Karen or Claudette? I don't know where
I'm not sure about that. I'm not sure about the 200,000 nurses. I know that we're roughly 24,000 nurses short in the province, that we have approximately 9,000 vacancies, but we have thousands of internationally educated nurses that we're trying to get on board. That is what I understand. So, you know, we need the government to provide more resources. Nurses are interested in the profession, and there are new young people that are coming into the profession. It's a hopeful profession. We need it. Nurses are the backbone of the system. So, you know, let's do all we can. Let the government listen to nurses and others like Karen's organization and Michelle, because we've got some answers, but nobody is inviting us to the table to sit down and really talk about these things. The government has put a provincial nurse in place, and, you know, allow that provincial nurse to have a say. You know, we've got funding coming from the federal government. We want to have strings attached so that those resources go to where it's needed to benefit nurses that are in the system and not being taken out to go for profit care.
Okay, before I pass this over to Karen, I just want to say, in the questions that we received beforehand, people were asking, can we pressure the federal government to deal with the healthcare crisis? Claudette, you just mentioned the leverage point. The federal government's going to be increasing healthcare funding for the province. We've got to make sure that there are strings attached, that it goes to public not-for-profit facilities and not to these private for-profit facilities. Karen, did you want to finish that other comment about the nurse training?
Well, you know what, the supervised training opportunities were really hampered during COVID, which unfortunately the nurses that graduated without having that, you know, on the ground training are just, unfortunately, that little step behind. They're coming, they're great, but the workforce that's there to train them is already tapped. So it's just a cumulative effect. I haven't heard of any barriers to supervised training opportunities at this point, but we do keep our eye on that.
Okay. Yes, actually, I met with a number of doctors and nurses who were, you know, deeply concerned during the pandemic that the trainees were not able to get, you know, on the floor training. No. And I think, you know, with healthcare, it's such a hands-on profession. You know, nothing can duplicate it. You can't learn, you know, to be a nurse or a doctor in a book, from a book.
No.
Okay. Let's see, I want to go back to regulations. And Michelle, you talked about this earlier. Who will provide, oh, you already mentioned who will provide safety inspections. You were talking about they're going to have the private for-profit clinics will have private inspectors. And so those will not be accessible through Freedom of Information requests. So how can we enforce the regulations and make sure that these clinics are actually doing what they're supposed to be doing?
Well, if I may, I think the problem is that the structure is such that we can't do that. We can't actually get our hands on that. And the only way to prevent this situation is to not go down the direction of these for-profit clinics. We have to stem that. And what Ford is trying to do very, very quickly, by the way, the legislature returns February 21st. This is going to be rammed through within the next few weeks. We won't have any, there is no regulation there. I mean, I think the question to me is not how can we regulate this very obviously, you know, for-profit system that is going to siphon money out of the public system and have detrimental effects on the overall potential of that system. I think the question is how do we stop that direction from happening in the first place? And I mean that's more my my area of activity or work.
How we're going to regulate it. Yes. Okay. Thank you for that. Let's see. Somebody writes, having grown up in the UK, oh, it's Paul Alex. Having grown up in the UK, linking healthcare education and service in the system is key. Nursing degrees are partly subsidized through public money. However, nursing graduates are therefore required to work for a minimum of 3 years in the NHS. The UK is publicly funded and free at the point of care healthcare system. This helps encourage professionals to choose the NHS. I mean, they've got a very different system than we do here. Is there, I think there's something similar in at least medical training, you know, doctor training in Ontario, where you can get a subsidized tuition if you're willing to commit to working in northern or remote communities. Is there something similar in nursing, or is there something similar to what Paul Alex is describing in the UK, in Ontario?
I'm not aware of any as I speak, but I don't have all that information with me right now. But I would say it'd be fair to expect some kind of, payback from something that has been invested in you, but rather go further than that. What about helping nurses to build careers here in Ontario so they're not trying to put in the time that they're required to do and then go dashing off at the first opportunity that they get? Why don't we make Ontario attractive? Make it attractive for people to build and maintain their career here. So I think that is the broader perspective.
I want to ask too, nurses, what is the cost of a nursing program at university or college? Like, how much is the tuition fee? Does anybody know? No, maybe we could.
I don't know. I don't have the dollar amount, but it's it's probably what any other a fee would be for a university education for undergraduate nurses. So it's not cheap. Yeah, it is not cheap.
This is one of the other bones that when we're talking about privatization, the privatization of college and universities, and I know I'm going to date myself, but even, when I started university, tuition fees were $1,000 a year for every program. Whether you're going undergrad, medical school, dental school, MBA, everything was about $1,000. It stayed similar until 1995. It was $2,500 a year. And then they deregulated professional fees. So those are through the roof now. An MBA at University of Toronto, I think, is around $60,000 per year, and it's a 2-year program. Medical schools, $28,000 a year. The last time I looked, law school, similar. And so, we've got this enormous student debt. And I'm wondering, I'm sure that healthcare professionals are impacted by this debt as well. I know a PSW who is deeply concerned. She has health issues, and she's deeply concerned about her student debt because with her health issues, she can't consistently work 12 months a year, and yet she still has to pay off this debt. If we were to eliminate tuition, or to at least drastically reduce tuition, would this be a way of attracting more people into the healthcare profession in Ontario?
I think it certainly would, because we know that there are many that want to get into the education, and not everyone can afford it. People are taking on the debt themselves. So making all that supportive of nurses that are coming into the system. There's also nurses who are seeking, graduate education, doctoral education. We need these professionals to help us, continue the excellence, continue the research, teach. So any help from the government will be greatly appreciated, I am sure.
Okay. Let's see. We've got, wow, so many comments, lots of discussion going on here. How can we help organize? Yes, I think we're pretty much ready. We've covered a lot of topics here. I think we're ready to talk about next steps. Like, how do we actually fight back? And I think that's what a lot of people have come here for. I think, people wanted the background information. They wanted the arguments. They wanted to know, how do we fight privatization? What arguments can we make to do it? I think we've got a lot of that. We may cover some more of those, but let's talk about organizing. Let's talk about action steps. And Michelle, I know you've got some action steps. Karen and Claudette, I'll give you each a chance too. We've got a petition in my office, and Benna from my office is online here. She will post the link to our petition in the chat. And Benna, can you tell them about the survey that we're doing?
Sure. Hi, everyone. Thank you so much for being here. So as Chris said, we do actually have a petition. You can visit our website just at www.chrisglovermpp.ca, and you can go to the petition there. But I have added the link here just so you can easily access it. The other thing is we did create a feedback form just to get your experience. And it's amazing because that will allow MPP Glover to bring your voice to the legislature as well as other actions we take, whether it's maybe holding a presser or on social media or whatnot. So I have also included the feedback form here as well. So please feel free to click on both of those.
Okay. Thank you. Thank you, Benna, for that. And we'll pass it over to the others. But before we do that, I just want to say, Janet, I think Janet on the chat was commenting, I think on my $1,000 tuition. She says, really dating yourself, MPP Glover. Anyways, I guess I am. Michelle, we'll pass it over to you. What actions can the people on the screen here take in order to protect our public healthcare system?
Thank you very much. I think definitely sign the petition that your office has set up, and I think that's something to circulate broadly as best you can. I'll just mention a few things that are coming up. We have an emergency organizing meeting, which you are all invited to on Tuesday, January 31st. The details are in the chat for that event, and maybe they can be circulated as well in some other way. At that meeting, what we want to do, every single person can actually do so much in the simple day-to-day things that you do just by talking to your your family members, your fellow workers or students, your colleagues about the situation and what they can do. We need to sign up everybody as a public Medicare defender. So if you go on the Ontario Health Coalition website, you can sign up there and you'll be kept in the loop, because there's going to have to be a lot of mobilization. In terms of demonstrations, there is going to be an action on Saturday, February 25th at Queen's Park, and it's being organized by a broad coalition of groups that it includes the campaign around the Greenbelt and stopping the opening up of the Greenbelt, but obviously healthcare, the fact that Indigenous communities were not consulted on the Greenbelt. So we're going to have everybody there to show our solidarity for each other and to try and push back on these attacks. And like I said, there's room for everybody. Everyone can play a role. I know the nurses have an action coming up, and I'm sure you're going to talk about that. But we need to support our the workers in public health, because frankly, the biggest I think the biggest defense of our public system lies on the shoulders of all of us, but especially the workers who do this work day in, day out, and who are really being abused. And we need to not allow it to happen. We need to all stand together, and we can push back and win. And that's what I want to leave on, is that we did fight against the attempt to make cancer care treatment privatized. This was a way back, I will date myself as well, under Mike Harris in the early days. They amalgamated hospitals, they ran roughshod and created a lot of the problems that we're living with today. And that one, we pushed back and they had to roll it back. And we can do that again.
Okay.
Thanks very much.
No, thank you, Michelle. And thank you for that. So what we'll do is the links and the actions that you're describing, we will put those out. We'll send a follow-up email to everybody on here, and I'll include it in my next update to the community so that people can take those actions. Claudette, did you want to talk about the nurses' actions?
Well, yes, first and foremost, I know that we're not yet in an election, but plan now to get out and vote. Everybody needs to vote. We had a very poor turnout the last time, so everyone get out and vote. RNAO also has action alerts that can be signed by the public and everyone. So sign the action alerts. Again, we try to get up to the thousands. We've had close to 30,000 on a recent action alert. Also, we need to work together, as Michelle was saying, and Karen was saying, we need to work together to fight, because we can fight. Every single person on this call and others that we know that, everybody has a member of provincial parliament, such as Mr. Glover, who's given us this wonderful opportunity. So everyone needs to get out and say to their MPPs what is going on. You've heard the challenges. You need to help us. RNAO, we go through the year with different, what we call Queen's Park on the road, so that we actually go to MPP's offices to meet with them. Coming up in a month, we will have breakfast with the MPP. So it's everyone can be involved. So we can write letters to the editor, make a short video, bring your friends and your family, because healthcare concerns us all. We're talking about it, as down the road, but we never know when we ourselves or our loved ones is going to need healthcare. And it's very important that we protect our public system.
Okay, thank you. Karen, action items.
Sorry, I'm muted. We have the same types of things going on. I didn't really get any dates or anything written down, so I do apologize for that.
That's okay.
But
We can,
have,
you know what? Whatever
you know,
get,
letter writing
forward to.
campaigns and phoning MPPs. We've held information pickets at MPP's offices, alerting people to the dangers of privatization. We've encouraged our members to come out and participate in the Ontario Health Coalition rallies. We participate in the 5 unions. That's about it. Sorry.
Okay. No,
I
that's
know
wonderful.
there's more,
And,
but I will get that information from you.
That's good. Yeah, send it to our office, Karen, and we'll.
Yes, I will do that.
We'll provide, we'll make sure that everybody gets these action items. You know,
Yeah.
I wanted to cover this because I want to make sure that everybody gets the action items. But I've got a couple of other questions before we close up the session. One is, at the beginning of the pandemic, you know, Premier Ford was talking about healthcare heroes. You know, and we were out, and we did it in my condo building where we're all in lockdown. We're out banging on pots and pans just to say, hey, thank you for what you're doing out there. I mean, now this government's, you know, been found in violation of your charter rights as healthcare workers, but with Bill 124 and freezing your wages, you know, unconstitutionally, they're appealing that. And so this government is not treating you like healthcare heroes. Is there something that we can do in the public to make sure that the healthcare workers who serve us, you know, feel appreciated and understand that we appreciate the work that you're doing?
Come out and vote.
Okay.
You have to get out and vote.
Mm-hmm. Yeah.
Because you know, it's, people are, it was wonderful, the public support, but at the end of the day, nurses need to feed their families as well.
Right. Right.
And so come out and vote.
Okay.
Yeah.
Claudette?
Yeah, I just wanted to take a moment to thank the media, who I'm sure with Karen and Michelle, the same thing, that they have been coming to us to you know, deal with the issues. So they're really giving air and attention to the issues that we're talking about today. So we really want to thank them for their efforts. And again, together, we can really make a difference. Okay,
great. And I see in the chat, the Ontario Nurses Association campaigns, there's a link there for people. And another question in the chat is, would directing some of our organizing efforts towards the federal government be effective to ensure that our public dollars go to public health care? Should we be directing some of our organizing towards the federal government? Michelle, do you want to start with that one?
I mean, I think it is extremely worrying and disappointing that in the midst of all of the announcements that Doug Ford made, what seemed to be said by the federal government was we're okay with this. You know, and the whole question of funding, there's going to be a meeting February 7th of the, I guess the premiers or the health ministers with Trudeau to talk about this funding deal, but there's no strings attached. And I think we should be very worried about that. I think we can, if we do a good job in Ontario, and this is our big challenge, if we do a good job in pushing back on Ford's plan, it will affect what happens at the federal level. It will have a very positive effect in the sense that people are saying, we do not want this. If we don't say anything, and if we don't succeed, it will make it harder. No doubt about it, because I think what you know, I would say the federal government is doing is really allowing this to go on. I don't see any attempt to stop it.
You know, and this is one of my concerns too, that however far this goes in the direction of privatization, it's very difficult to get it back. It's difficult to get it back into the public sector. We saw that with long-term care under Mike Harris. It was largely privatized. It was converted from a not-for-profit system to a private for-profit system. The regulations to protect seniors were stripped away. There used to be a Seniors Bill of Rights that was stripped away from the legislation. The regulations that mandated care for people in long-term care homes was stripped away. You know, anything that would maximize profit was done and minimize care. And then we saw this horrific situation described by the armed forces, you know, in their report. Just terrible, disgusting things that you would never have thought could happen in Canada. I am deeply concerned about, you know, this privatization of healthcare, because it's along the same track, and we're handing over our healthcare system to the same, you know, corporations and corporate leaders that put profit far, far ahead of care. Let's see, I think we've covered most of the territory that we intended to cover. We do have a few more minutes. If anybody has anything that they'd like to add, just throw it in the chat. But what I'll do is, you know, and if anybody has some, anybody watching, if you have a final comment you'd like me to read, throw it in the chat. And in the meantime, I'll get each of our speakers just to give a wrap-up comment, you know, or a couple of comments to wrap up about this. So who would like to go first? Claudette?
I can.
Okay.
So thank you for the opportunity, and thanks to all who came on board this evening. It's great to know that we're in a community that cares, and we can spread the word so that similar things can happen across our province. And it is absolutely critical that we protect our publicly funded healthcare system. Let's put our energies into making that stronger and better for all Ontarians. We want to have equitable healthcare for all.
Wonderful. Thank you so much. Michelle.
What Claudette said there, I 100% agree, and I think we can make a difference. We can make a change, but we just are going to have to dig in and not let ourselves get thrown off by, you know, I hear the pundits saying, "Oh, you're being so emotional." Be emotional. It's there is so much at stake. We know what's at stake. We know that from history what's at stake. So please, by all means, just whatever end you grab. If you're an artist, if you're someone who likes leafleting, there's so much work to do, and you can connect with any of our organizations that have been in the chat. Thanks so much for everyone coming out tonight. It's fantastic. It makes me feel much more confident about we can do this.
Wonderful. Thank you, Michelle. Thank you for being here, and thank you for your continued advocacy. Karen.
I just want to say thank you again for everybody who's come out and supported this. And I'm going to echo Claudette and say equitable healthcare for all. We need to fight for this. We cannot stand by and watch this disappear. We have to do something.
Okay.
And get emotional. You're right, Michelle. We need to get emotional.
Yes. I think, you know, this is an emotional thing. I mean, just look at the trauma of people going to emergency rooms or phoning an ambulance. You know, a friend was telling me they phoned an ambulance for their grandmother a few weeks ago in Hamilton, and there was a 3-hour wait. You know, I mean, that's just insanity. Like, this is an emotional topic. And the other, you know, I'll just give one other example. Like, my father, his aunt died of cancer in the 1950s. And her husband was a very successful businessman. They had 3 children. She developed breast cancer. 3 years after the diagnosis, she died. This was before we had public health care in Canada. By the time she died, her husband had sold the house, he'd sold the car, he was destitute. You know, they'd gone from a middle income existence to destitution. The aunt's sister had to pay for the funeral because he did not have the money to pay for the funeral. So after her death, he was, you know, had 3 young children and starting over from scratch, you know, to build a life for them and for himself, you know. These are the stories that we're hearing in the United States all the time. 66% of bankruptcies in the United States are tied to healthcare. We've got to protect our public healthcare system in this country. It's vital. It is an emotional issue. And the current crisis is deliberately being created. There are solutions that this government has been ignoring for months and years. And instead of fixing our current system, they've been creating the crisis in order to provide an opportunity to privatize it and to direct our tax dollars to private for-profit corporations. And we've got to stop it. We've got to call it out, because this is an absolutely egregious abuse of their power. And they have, as people have said before, they have absolutely no mandate to privatize healthcare. They never mentioned this during their election campaign. If they had, they would not have won a single seat, I think, honestly, in this province. So let's get out there. Let's fight. We've got some action items. There's the petitions from both the Health Coalition and from my office. And there's also the Registered Nurses of Ontario are looking for healthcare advocates. So you can sign up there as well. And please get out. Let's win this fight. Let's protect our public healthcare system. Thank you, Karen. Thank you, Claudette. Thank you, Michelle. And in the background, I also want to thank Benna and Nancy, who put together this meeting and have been operating the Zoom and got you all here. So can we give a round of applause to Nancy, Benna, Karen, Michelle, and Claudette for being here tonight. Thank you guys so much. Okay. And we'll see you out there, folks. Thank you again, everyone.